Hi, I'm Haley, and we're going to help you make 100 on your HESI by reviewing Thyroid Toxic Crisis or Thyroid Storm.
Alright, this is a little A&P review for you. The thyroid gland is located in the anterior portion of the neck, right here in front of the trachea, and that gland produces T3, T4, and calcitonin.
To assess the person's thyroid gland for goiters or enlargements, you're going to tell the person that you're coming up behind them first, and you're going to assess the trachea for the midline. You're going to place your hands there and ask the person to swallow. No enlargements or goiters noted.
Now turn to the person to your right and assess their thyroid. A thyrotoxic crisis, or a thyroid storm, is a rare, life-threatening event. It's an emergency, and it's caused by uncontrolled hyperthyroidism or Graves' disease. The causes are unknown, but it can be by different stressors like infection, trauma, surgery, and that's on any people that have pre-existing, that's undiagnosed or diagnosed hyperthyroidism.
During a thyroid toxic crisis, all hyperthyroid manifestations are heightened. The signs and symptoms include severe tachycardia, shock, heart failure, hyperthermia, including temperatures up to 105.3 degrees, which can cause brain damage, restlessness, agitation, seizures, abdominal pain, nausea, vomiting, diarrhea, delirium, weight loss, goiter, coma, and exophthalmos. To assess your patient, you should look for accelerated body processes such as weight gain and an increased appetite. You should also check your patient for exophthalmos, hyperthermia, nausea, vomiting, diarrhea, and a decreased thyroid stimulating hormone level and a T3 level of 220 or above and a T4 level of 12. This is an image of a woman who has exophthalmos and a goiter with Graves' disease. This is another image of a person with exophthalmos and Graves' disease who is suffering from hypothyroidism. Go.
Alright, thyroid storm treatment, if it's initiated early and vigorously, you can prevent the serious side effects or symptoms, which is death and a coma. The main treatment, the purpose of the treatment is to decrease the thyroid hormone levels, and part of the treatment you could use is a hyperthyroidism diet, which is a high protein, low calorie diet. And if you're having the nausea, vomiting, diarrhea symptoms, you also need to lower your fiber. The true first line therapy is the drug therapy. The first drugs are the anti-thyroid drugs, Tapazole and PTU. Tapazole is an anti-thyroid, like I said. It inhibits the synthesis of thyroid hormones by decreasing iodine use in manufacture of thyroglobin and iodothyronine, and it does not affect the circulatory T4 and T3 levels. PTU, it blocks the synthesis peripherally of T3 and T4, and it inhibits the organification of iodine. Iodine is a different drug. It rapidly inhibits the synthesis of T3 and T4, and it blocks the release of T3 and T4 into circulation. It's usually used before surgery, before thyroid surgery, because it gets it to a more euthyroid state. It decreases the vascularity of the gland. And then some other drugs are beta blockers. Beta blockers are another drug used. The one that's mainly used is Inderal, but you can also use Tenormin. Tenormin's used for patients that have asthma, and also a thyroid. Radioactive iodine therapy is the best treatment for non-pregnant adults, and the most important thing to remember about that is that they are on isolation for 72 hours after treatment. The last line of therapy is the surgical therapy. You can either have a total or a subtotal thyroidectomy. The subtotal, you remove 90%, and if you remove too much, it's approximately 90%, but if you remove too much, the gland won't regenerate. And surgical therapy is usually for candidates that aren't good candidates for the radioactive iodine therapy, or the drug therapy is not working fast enough, the hormone levels aren't dropping quick enough, or it's in patients that have a malignancy or a goiter that's so large it's compressing the trachea. And those are the reasons for the surgical treatment. And in surgical treatment, after that you have to watch for bleeding and swelling, and maintain the airway, and make sure you have a tracheostomy set kit ready at the bedside. And remember about thyroid storm is that the most important nursing intervention is to maintain the airway and adequate aeration. So you'd want to have a pulse oximeter, and you probably would also have some oxygen running. So, and just maintain good levels for those.
Here are some hefty hints that came from the book. You need to know that Tapazole and PTU are antithyroid medications used in a thyroid storm. Another important one is Inderal, that decreases excess synthetic stimulus. Another hefty hint that you should be aware of is that after a thyroidectomy, it is important to stabilize your patient's neck, and to also have a tracheostomy kit, a nasal cannula, and a suctioning kit present in case of airway compression or constriction. One more hefty hint that you should know is that after a thyroidectomy, you should have calcium gluconate at the bedside, because if you remove too much of the thyroid, it can cause there to be a drop in calcium levels.
In conclusion, this is going to be a quick review for you. Thyroid storm is severe hyperthyroidism. It's an emergency, and these are the signs and symptoms. The main ones that you should know are weight loss, goiter, and exophthalmos. And you also have these other ones, extreme tachycardia. Always know the first line of therapy is drug therapy, and then radioactive iodine treatment and therapy and surgical therapy. Remember during a thyroid storm to maintain the ABCs, and the most important nursing intervention is maintain airway and adequate aeration. And also a diet is high protein, low calorie diet, and low fiber. Thanks, and do great on the HESI.
I like big thyroid, and I cannot lie. You other nurses can't deny.